Bismillahirrahmanirrahim. My name is Sulaiman Hasham, fourth semester, Group 24 from International Medical University of Kyrgyzstan. Today, my topic of presentation is anti-anginal drugs. Coronary circulation. First, we have to define coronary circulation. Coronary circulation is the circulation of blood in the blood vessel that supply the heart muscle myocardium. Myocardiums are heart muscles. It is that type of circulation in which blood supply to the heart. The left coronary artery include circumflex artery, supply blood to the left atrium, side and back of the left ventricle. Left anterior descending artery supply the blood to the front and bottom of the left ventricle and the septum. These two arteries supply blood to the left side of the heart, left atrial and left ventricle. The right coronary artery supply the blood to the right side of the heart, like right atrium, right ventricle, bottom portion of the ventricle and back of the septum. Angina. What is angina? Angina is the type of chest pain caused by reduced blood flow to the heart. Angina is the symptom of coronary artery disease. Angina pain is the pain which is felt when the coronary arteries are blocked or blood flow to them are come slow. So the chest pains occur which known as angina pain. Angina, also called angina pectoris, is often described as squeezing, pressure, heaviness, tightness or pain in the chest. Symptoms. Symptoms of angina. Angina symptoms include chest pain and discomfort, possibly described as pressure, squeezing, burning, or pullness. Patient may also have pain in his arm, neck, jaw, shoulder, or back of other symptoms that patient may have with angina include dizziness, fatigue, nausea, shortness of breath, and sweating. Types of angina. There are three types of angina: stable angina, unstable angina, parenchymal angina. Stable angina is usually triggered by physical activity when patient climbs stairs, exercise, or walk. Patient's heart demand more blood, but narrow arteries slow down blood flow. During exercise or some physical work, climbing stairs, walking, patient heart demands more blood as the heart rate increase, due to which the heart demand increase, and the coronary arteries due to narrowed arteries, the blood flow to the coronary circulation becomes slow, due to which pain is felt, called stable angina. Unstable angina and petty deposits clogs in a blood vessel's rupture or blood clot form it quickly block or reduce flow through a narrowed artery. This can suddenly and severely decrease blood flow to the patient's heart muscle. Unstable angina can also be caused by blood clots that block or particularly block patient heart blood vessel. Unstable angina occur due to the blood clot forms in the narrowed coronary arteries, which suddenly complete block or reduce blood flow to the coronary circulation system. Unstable angina can also be caused by blood clot that block particularly patient heart vessel, blood vessel. Parenchymal angina type of angina is caused by a sudden spasm in a coronary artery which temporarily narrow the artery. This narrowing reduces blood flow to the patient's heart, causing severe chest pain. Parenchymal angina most often occur at rest, typically overnight. Parenchymal angina occur in the rest position, manually in the night. Due to the temporary narrowing of the arteries, blood flow reduced. The following risk factors increase the risk of coronary artery disease and angina pain. Tobacco use. Tobacco use is the most common cause of the coronary artery disease and angina pain. Diabetes, high blood pressure, high blood cholesterol and triglyceride level, family history of heart disease. These are the common causes of coronary artery diseases and angina. Men, older men which have age 45 or more and women older than 55 are great risk than younger one. Atherosclerosis refer to the atherosclerosis are the buildup of fats, cholesterol, and other substances in and on the artery walls which can restrict blood flow. Atherosclerosis is that condition in which the fats and cholesterol and other substances combine stick with the artery walls which can restrict blood flow to the heart. Causes of drug Classes of drugs used in the treatment of angina and myocardial infarction. Vasodilator dilate arteries and veins. Calcium channel blocker, nitrodilator, cardio-inhibitory drugs reduce heart rate and contractility. Beta blockers, calcium channel blockers, rano, ranolazine, blockers of lead sodium currents. Antithrombotic drug prevent thrombus formation. Anticoagulants and antiplatelet drugs. First of all, vasodilator dilate arteries and veins. Primary cardiovascular action of nitrodilator. Systemic vasculature. Vasodilator venous dilation more than arterial dilation. Decrease venous pressure. Decrease arterial pressure. Small effect. Cardiac. Reduce preload and afterload. Decreased wall stress. Decrease oxygen demand. Coronary prevents reverse vasospasm, vasodilation, primarily epicardial vessel. Important subendothelial perfusion increased oxygen delivery. Azosorbate, mononitrate, nitroglycerin, pentaerythrol, and entothyroid. These drugs are vasodilators which action on sodium nitroprusside, organic nitrates. Side effects of the drugs used for vasodilation: rapid heartbeat, tachycardia, heart palpitation, fluid retention, edema, nausea, vomiting, flushing, headache, and secretion hair. Beta blockers: etinolol, bisoprolol, metoprolol. These drugs are beta blockers. The most common side of beta blockers are fatigue and dizziness. Beta blocker slow down your heart rate. Poor circulation. Your heart beats more slowly when you take beta blockers. Gastrointestinal symptoms. These include upset stomach, nausea, and diarrhea or constipation. Sexual dysfunction, weight gain. These are the most common side effects of beta blockers. Calcium channel blockers, verapamil, calonviralan, deltazim, cartesian, tiazic, pelodopine, amlodopine, nifedipine, adalciprocardia. These drugs are calcium channel blockers. Side effects of calcium channel blockers may include constipation, dizziness, fast heartbeat palpitation, fatigue, flushing, headache, nausea, rash. Rano, ranolazine represents a new class of anti-anginal. Ranolazine Renzia. The mechanism of action of ranolazine's anti-anginal effects has not been determined. Ranolazine at therapeutic level can inhibit the cardiac late sodium current. However, the relationship of the inhibition to angina symptoms is uncertain. Lead is normally 1 sodium. Lead is normally a small but present current. It is an active current during the flow phase of the cardiac. During the plateau phase of the cardiac therefore the current can play a significant role in determining the duration and the shape of navy. During QT interval, it causes prolongation of the QT prolongation effect of ranolazine on the surface of electrocardiogram is the result of inhibition of 1KR which prolong the ventricle action potential. The variable blood vessel attained after a given dose of ranolazine gave a wide range of effect on QC quarter. At T maximum following refills during at 1000 mg twice daily. The main change in TUC is about 6. Anti-thrombotic drugs prevent thrombus. Thrombocytes are platelet cells in the blood clot formation. Aggregation. The blood clot formation is coagulation, cascade, and a very complex step-by-step process that occur in the body when a blood vessel is injured. For example, atherosclerosis. 13 special proteins known as coagulation plasma factor are activated one after the other in a cascade effect. Coronary thrombosis is defined as the formation of blood clot inside a blood vessels of the heart. This blood clot may then restrict blood flow within the heart, leading to the heart tissue damage or myocardial infarction, also known as heart attack. There are 13 factors which are involved in the formation of thrombocyte. Factor 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and 13. Anti-thrombotic drugs, the drugs which are anti-thrombocyte, which are used when the thrombus are formed for the removal or for the dissolution of thrombus. Anticoagulant, the drugs which prevent coagulation of platelets and coagulation proteins. Heparin, nodaferin, calcium, proxaferin, rivaroxaban, Xarelto, warfarin. Antiplatelet drugs. Clopidogrel, Plavix, dipyridamole, acylic acid, aspirin, thrombo, efzimab. These are antiplatelet drugs. platelet thrombocyte aggregation. Clopidogrel action on ADP receptors. Dipredamol or 1-CAMP thromboxane synthesis acronic acids. Acetylic acid plasma coagulating factors. Vitamin K helps to regulate the process of blood coagulation by assisting in the conversion poor coagulation plasma factors is called vitamin K defending factors into their mature form warfarin K. These are which indirect anticoagulants factor 2, 7, 9 and 10. Noradopterin, calcium and heparin. Heparins are 1 factor 1 and 13. These are direct anticoagulants. Drugs with their internal dose, parental dose and half-life. Vasodilator. Azosorbate mononitrates have internal doses 10 mg, 20 mg, 125 mg spray. Have no parental dose. Half-life of azosorbate mononitrate is 5.1 hours. Nitroglycerin have internal doses 0.3, 0.4, 0.6 mg and 400 mcg spray, having half-life 1.5 to 7.5 minutes. Pentaerythritol tetranitrate have internal doses 80 to 100 mg, have no parental dose. Half-life is 4 to 5 hours. Sodium nitroprusside have no internal doses. Parental doses are 25 to 50 mg per 2 milliliter, having half-life of 2 minutes. Beta blockers, etinolol, having internal doses 25, 50 and 100 mg, having no parental doses. Half-life is 6 to 9 hours. Bisoprolol 5 to 10 mg, no parental doses, 10 to 12 hours is half-life. Metoprolol internal doses 5 mg, parental dose of 1 mg per milliliter. Half-life is 3 to 7 hours. Calcium channel blockers. Verapamil, Virilan 40 to 40, 80, 120 mg. Parental dose 2.5 mg per milliliter, having half-life 3.34 hours. Deltazim, cortisone, Tizic have internal doses are 120, 180 to 40 mg, having no parental dose. Half-life 3.2 hours. Pilodipine 2.5, 5, 10 mg, half-life 25. Amlodipine Norvasic 2.5, 5, 10, half-life 35 to 50. Nifedipine Delt CC Procardia 10, 20 mg, half-life 7 hours. Blocker of lead sodium. Renolazine 500 milligram and 1000 milligram. Half-life 7. Anticoagulant heparin sodium parental dose 10,000, 12,500, 20,000 or 25,000 USP. Half-life 60 to 90 minutes. Nadoropin calcium praxiferin parental dose 3,800, 9,500 units. Half-life 3 to 7. Rivarobazin, Rivarozabin, Xarelto 2, 5, 10, 15, 20 milligram. Half-life 5 to 9. Warfarin 2, 2, 10 milligram. Half-life 20 to 60. Clopidogrel bisulfite, bisulfate Flavix. Internal dose is 75 milligram, 300 milligram. Half-life 0.5 to 1. Dipyridamole 25, 50, 75 milligram. Half-life 10. Acetylsalicylic acid, aspirin, thrombo 5, 50, 75 and 100 milligram. Half-life is 20 to 60 minutes. Epcizumab parental dose 2 milligram per milliliter, having half-life of 10 to 30 minutes.